Thank you, Mr. Chairman. Dr. Price, good to be with you again. Thank you.
Thank you.
I wanted to ask you a couple of questions that center principally on children and individuals with disabilities. First, with regard to children, I think if we're doing the right thing, as not only as a government, but as a society, if we're really about the business of justice, and if we're really about the business of growing the economy, we should invest a lot and spend a lot of time making sure that every child has health care. The good news, despite a lot of years of not getting to that point, not moving in the right direction, the good news is we've made a lot of progress. The Urban Institute, in a April 2016 report, I won't ask the report to be made part of the record, but I'll read a line from this Urban Institute report, Uninsurance Among Children, 1997 to 2015, dated April 2016, said as follows on page 3. It said that the decline in children's uninsurance rate occurred at a relatively steady pace and includes a significant drop following implementation of the Affordable Care Act's key coverage provisions from 7.1% in 2013 to 4.8% in 2015, unquote. So that's a significant drop. 7.1 to 4.8 is millions of kids have health insurance today that would not have it absent the Affordable Care Act and including the Medicaid provisions as well. That 4.8% uninsured rate for kids is an all-time low. That means we're at a 95% insured rate across the country for children. Kaiser Foundation, a separate authority, tells us that even with that, even with all that progress made in the last couple of years and even some progress before that, we still have more than 4.1 million children uninsured. Would you agree with me, first of all, that we should get that number down, the number of uninsured children?
I think that throughout our population, we ought to identify individuals who are uninsured and
Right.
strive to make certain that they gain coverage.
And you'd agree with me with regard to children especially?
Well, everybody in the population, but children are precious and are our future.
Great. And just with regard to children, now that we have that number, we know the number that we've arrived at, we know the percentage, will you commit, if you're successful in your confirmation, to maintain or to even reduce that uninsured number even further? In other words, that you will be able to commit to us today that the number of uninsured children will not increase under your during your time as secretary, were you to be confirmed, and the percentage of uninsured would not increase while you're secretary.
Our goal is to decrease the number of uninsured individuals in the population age under 18 and over 18.
Well, I hope you maintain that, because I think that's going to be critically important. The reason I ask that question is not just to validate that as a critically important goal for the nation, but your answer seems to be contrary or in conflict with what you have advocated for as a member of the House of Representatives, not only in your individual capacity, but as chairman of the Budget Committee. Looking at now, for reference, an op-ed by Gene Sperling. You know who Gene Sperling is. He was head of the Council of Economic Advisors to two presidents, both President Clinton and President Obama. Chair of that National Economic Council, I should say, is the proper title. In an op-ed on Christmas Day, the 5th paragraph, here's what he said in pertinent part, referencing you and your budget proposals. He said, quote, "Together," meaning the two areas of policy that you've have a long record on, full repeal of ACA and block granting of Medicaid, which we now know is the Trump administration policy, quote, "would cut Medicaid and the Children's Health Insurance Program funding by about $2.1 trillion over the next 10 years, a 40% cut," unquote. How can you answer the questions that I just asked you about making sure that that number of uninsured children doesn't get worse under your tenure, if that is the case with regard to your policies, the effect of what your policies would be, and now apparently contrary to what was said during the campaign. It's now the policy of the Trump administration to block grant Medicaid.
Yeah, with respect to both you and to Mr. Sperling, it's because you all are looking at this in a silo. We don't look at it in a silo. We believe that it is possible to imagine, in fact, put in place a system that allows for greater coverage for individuals, in fact, coverage that actually equals care. Right now, many of those individuals, the ACA actually increased coverage in this country. It's one of the things that it actually did. The problem is that a lot of folks have coverage, but they don't have care. So they've got the insurance card, they go to the doctor, the doctor says, this is what we believe you need, and they say, I'm sorry, I can't afford
a cut of $1 trillion, a combined cut of $1 trillion that would adversely impact the Children's Health Insurance Program and the Medicaid program is totally unacceptable, I think, to most Americans.
And
Democrat, Republican, or otherwise.
And you're looking at that in a silo. You're not looking at what the reform and improvement would be.
We'll see the rebuttal to what not only Gene Sperling has said, but a whole long line of public policy advocates and experts. And I think the burden for you, sir, is to make sure that you fulfill your commitment to make sure that no children will lose health insurance coverage while you're a secretary.
Look forward to working with you.